In this case, we have a patient with a plantar ulcer corresponding to the second metatarsal. This is a neuropathic lesion, so the priority is to reduce the pressure. In order to alleviate the loading, it is of fundamental importance to locate the ulcerated zone whilst walking. In order to alleviate the loading, it is of fundamental importance to locate the ulcerated zone whilst walking. To this end, we cover the lesion with a transparent sterilized film, marking the lesion with a pen or lipstick. The foot must be positioned with care in the brace, ensuring that the first contact is with the heel, then the forefoot. The straps are fixed with Velcro to clamp the brace to the leg. We ask the patient to take a few steps, ensuring that the part of the foot with the ulcer is in contact with the inner sole. When the brace is removed, the lipstick shows the exact position of the ulcer, and this must be removed to reduce the loading. The system that we use with our braces is 3x3. There are 3 layers of colour with different grades of hardness and density. The blue layer is the hardest, the beige the intermediate, and the red the softest, each of which can be divided into forefoot, midfoot, and backfoot. We mark the perimeter of the ulcer with a pen, giving a margin of 5 mm up to 1 cm from the edges. To remove this, we use a scalpel with the blade at a 45-degree angle. There are 3 rules to keep in mind with the composition of the 3x3 kit. The loading must never be directly on the ulcer. The weight of the patient is very important. Those above 90 kilograms must use the blue, whereas those of less than 90 kilograms, as in the case of our patient, use the beige. This means that the ulcerated part is only contact with the red layer. In this case, the forefoot. The advantage of a modular system like the 3x3 kit is that the composition can be altered horizontally to ensure that the ulcerated lesion is not directly in touch with the insole, and this then increases the loading on the rest of the foot. When a foot is deformed and rigid, it is possible to extend the loading to the lower layer to increase the offloading impact of the 3x3 kit. The patient is medicated with German cotton wool between the toes, covered with an adhesive bandage up to below the knee. Over this is placed an elastic cotton sock without seams, protecting the medication whilst limiting the pressure on the skin. Once this is applied, the 3x3 kit is inserted into the brace, and the foot of the patient is placed in position, ensuring that the entire sole of the foot is placed accurately on the insole.